pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We'll move on to item number 3, public comment. And there is nobody here in person for public comment and nobody online, Kelly? No? All right. Move on to item number 4, approval of the September 6, 2023 Health and Human Services Committee meeting minutes. Is
Motion by
there
Supervisor.
a motion to approve? Motion by Covelli,
Motion by
second by Arstead. And then are there any corrections?
Yes.
Use the microphone.
Yes, one correction. The approval, or the, let's see, call meeting to order says Chair Van Cray, and it should be Vice Chair Arstead. That's the only correction I see.
Thank you. Are there any other comments or corrections? Okay, seeing none, all those in favor of approving the minutes as corrected, say aye. Aye.
Aye.
Opposed? Right, none opposed, motion carries. Item number 5, policy issues, discussion, and potential committee determination. 5A, the North Central Healthcare budget. And we have Jason and Gary here to talk to us about that.
Where would you like?
I do have the packet is pulled up on that computer, which has the PowerPoint in it, if you guys want to go through that. You just have to scroll down.
Okay, there. That helps. So thank you for taking the time to listen to our budget presentation, kind of again, 2.0 here. We did give a little bit of a presentation a month or so ago, but I'm going to let Jason go through the budget for you, going to do a very high level. In the future, I've kind of talked to Lance. I think it'll be good if we're pretty much like one of your departments. We'll have pages in the budget like all the other departments do and be able to show it in the same format that everyone else does. Ours is a little bit different this time because we do have the different budget. But as we work to get closer, we'll do that for next year. But I'll turn the time over to Jason to kind of do a quick overview of our budget for you.
Great, thank you. So this is just what our budget book looks like. I believe there was a link in the packet, so please go out and take a look. It's a really informative budget book with a lot of great information in it. So if we look at this slide, what we're looking at here is just the individuals served by county. This is page 12 of the budget book. So if we look at Marathon County, you can see that in 2022 we had about 9,300 individuals were served in Marathon County with a population of 137, almost 138,000. In total, North Central served a little over 12,000 individuals. So diving right into the budget, for our 2024 total revenue, we have $89 million. Of that, we have net patient services revenue. That's just shy of $61 million. So that's the revenue that we're billing for. We have our other revenue, which makes up about $21 million. That would be, the majority of that is grant revenue. And then $6.6 million is county appropriations. So that's the tax levy that goes into operating North Central Healthcare. We look at our expenses, $89 million, so we have a balanced budget for 2024. The majority of our expenses at North Central Healthcare are salary and benefits, and that's just because we are service-oriented. We are providing services. We're not buying widgets. So salaries, $37 million, and then benefits were at about $22 million. And then other expenses, we have about $28 million. So fairly good size budget at $89 million for next year. So county appropriations, this is what I'm sure everybody's everyone's excited for. So historic county appropriations, this would be the tax levy. If we look at Marathon County, you can see for 2024, we have $5.8 million. That is an increase over 2023 of we had about $4.7 million. So it is an increase, and I'll go over what makes up that increase. As organizational wide, our levy has increased $631,000 over 2023, and that includes all three counties. Something I do want to point out is if you look at Marathon County, if you go back, or if you look down to 2016, you can see that we were as high as $7.8 million. There are 2 years where we had some big adjustments, and that's 2017, about $1.2 million. That was because we moved a family care payment out. And then in 2019, we had about $1.1 million reduction, and that's because we moved facilities costs to Marathon County. So those two combined, we are at about $2.3 million. If you were to subtract that off the $7.8 million and compare that number, which is about $5.5 million, to where we are in 2024, that's only about a $306,000 increase. So really, if you compare that back to and take those two big adjustments off, from 2016 to 2024, we've only increased tax levy by about $306,000. So relatively small over an 8-year period. This slide shows our county appropriations by county, and then how it's allocated out through the programs within the organization. You can see Marathon County is at $5.8 million. I won't go through everything, but it shows the programs on the left-hand side. I do like to look at tax levy in total rather than where it's allocated to each individual program. And the reason why is because a lot of our grants can be used. We have a lot of different eligible expenses for those grants. So, we could apply a grant to, say, the adult hospital, which would reduce that tax levy, but then it just moves it somewhere else. So I do like to look at it in total, but this does help give an idea of what programs are somewhat supported by the tax levy we do receive. All right, so the change from prior year, as you can see, as an organization, $631,000. Marathon, what makes up that $1 million increase is a 3% tax levy request that we had for the year. We requested 3% from all three counties. And then we have $904,000, and that is a levy request for additional services that were not previously funded. And I'll go into detail on those a little bit later. But that is what's making up that $1 million increase over 2023. So opportunities and challenges. We had a lot of challenges. It seemed like more challenges than opportunities this year, but we do have some really good opportunities. So Mount View, our skilled nursing facility, we saw an increase of 15% in our Medicaid rate increase. Last year we saw a double-digit increase as well, so had some nice increases in Medicaid. That increased our revenue by $1.3 million. And then next year we have our debt payment that we need to start making. So that debt payment in total is $2 million, and Mount View's portion is about $1.1 million. So we are hoping that that Medicaid rate increase can help cover that debt payment for next year. The one thing that we're unsure of is how this Medicaid rate increase will affect our supplemental payment that we receive from the state. We have seen that decrease because that is calculated based on our direct losses. And as the rate increases, our direct losses decreases. So we do think that that will go down a little bit, but we're unsure of what amount that's going to be and what that looks like. So If that does go away completely, it's going to make making that debt payment challenging. But we're hopeful that we don't see a huge decrease in that supplemental payment. We do have a really good opportunity in the nursing home. Our construction will be done hopefully by the end of November. So at that point, we'll be able to start looking at increasing our census. We budgeted a census of 128. As of today, we're at 119. We think we can get above 128 by the end of next year. So we budgeted an average of 128 for next year. A lot of that is dependent on staffing. Staffing is a challenge. We've had some really good months with recruitment at North Central, so we're hopeful that we can end next year above 128 for a census. Another opportunity we have is our adult behavioral health hospital. We increased our census from a budget of 7 in 2023 to 9.75 in 2024. This is resulting in gross revenue of about $2 million. Net, it's about $1.2 million. Right now, our year-to-date census is at 6.44, so we got some work to do to get to 9.75, but we think that's a realistic number. Staffing has improved quite a bit. A lot of that is dependent on staffing, increasing that census. We've had some really good luck hiring 6 additional staff that start on Monday. And then a lot of the concerns we had here was security, and our security department is full now. So we've made some really good progress in beefing up our staffing, which will help increase that census. And the reason why this program is a really big opportunity is because it's one of our opportunities to make money. So if you look at the other services we provide, a lot of them are grant funded or funded where we're reimbursed our direct costs and indirect costs, but nothing above that. This is an opportunity where we can actually generate additional revenue above and beyond our indirect expenses. So that's why this is a really big opportunity for us. All right, challenges. We had the debt payment of $2 million, which starts in 2024, and this will increase to $4 million over the next couple of years. So that's a lot of money to find in a budget in 1 year. So below is how we're going to fund that $2 million. So Mount View's portion, like I mentioned earlier, is about $1.1 million. That $904,000 that I talked about earlier, that levy increase from Marathon County, that makes up the rest of it, and that's everything that's listed below that Mount View portion. So $300,000 of that is an increase in CCS revenue. What that is we increased the rates that we reimburse social services for them providing CCS services and service coordination. And by doing that, they will be bringing in more revenue, which then, in theory, should decrease their tax levy for that program. So we're shifting that over to we have our crisis professional, our CART program, that's 2.0 FTEs, that's $240,000. This is something that we've been doing for quite a few years, but have never requested additional tax levy to provide. But now with the debt payment coming due, that's something that we can no longer do without the additional funding. We have the mental health therapist in the jail. It's 1.0 FTE. Same thing, we've been providing that service without additional funding. And then MMT, we're offsetting uninsured costs for justice system users. So we're hoping that when MMT opens, we're going to try to get more justice system users in through that program. Not all of those will be insured, so this will help offset some of that cost. And then Hope House is our sober living house, and this is the deficit that we have operating in that. So again, another program we've been operating, but have been doing so without additional tax levy. All right, some more challenges. So Pinecrest. Pinecrest is the nursing home that we operate in Lincoln County. We've excluded this from our 2024 budget. The reason why is because Lincoln County is pursuing the sale or selling Pinecrest. We're unsure if that is going to happen or what date that's going to happen. So we did exclude that for next year. And the reason we excluded that is because, one, it's much easier to include it if we need to. If the sale doesn't occur or something changes, the budget is done. It's just not in this budget. But also, it's the most conservative approach. So Pinecrest does cover a portion of our indirect costs. With them going away, we had to reallocate those costs within the other programs in our budget. So it made us look at opportunities to reduce those expenses to get a balanced budget. So that is the reason why we did exclude it for next year. And then staffing. Increasing our staffing is our top priority for next year. That's really going to allow us to meet those budget goals. So in order to increase our census in the hospital and the nursing home, we're going to need additional staffing. And we have implemented some really good strategies so far and have made some really good progress. Another challenge that we have, like most people, is health insurance. So we have a 7% increase in our premiums for 2024. That premium increase next year was projected at 2.6%, but we went a little bit above that for a couple reasons. One is we don't know what the impact of losing Pinecrest is going to be. There's about 200 staff there, and that could either benefit us, hurt us, might not affect us much at all, but we wanted to be a little bit more conservative. And then it's going to help build our fund balance. So prior to 2023, we never broke out our health insurance fund. We are self-funded, but we didn't have the fund set up. So we set that up last year when Gary joined, and we need to build that fund balance. So we should have about 40 to 60% of 1 year of claims expense in that fund balance, which would be about $3.5 to $5.2 million. So that's going to help us start to build that fund balance so we can be financially sustainable for the future. And then, that just brings another challenge of, as we increase our expenses, it's going to have an impact on our recruitment and retention. So as I previously said, staffing is a huge challenge, and making sure that our benefit package is competitive is going to be important for that. So just some general budget highlights. Things I've already covered these, but just wanted to point them out again. Mount View, we're budgeting a census of 128. We're hoping to get above that by the end of the year. Youth hospital daily census is at 4. And then adult hospital daily census is budgeted at 9.75. And again, these are important because these are revenue generating. So this is our opportunity to try to generate some additional revenue to help make that debt payment. So that I can take questions if there are any.
Right, are there any questions for Jason and Gary? Go ahead, Supervisor Krause.
Thank you. I have a question about the crisis intervention treatment. That seemed to be a huge expense. It was the largest. I think that was like maybe the third or fourth slide, and I believe it was $2 million. And I'm just thinking, why is there something that can be done to reduce the expenditures in crisis? Like, what are the causes and how can that expense or cause be reduced? It seems a huge amount of money for Marathon County. Of course, it covers the other 2 counties also, I'm assuming.
No, if you look up at the screen here, I think this is what you're referring to at the $2 million amount for crisis.
Yes,
So
for
Lang Lake
Marathon
portion
County.
is $105 Lincoln
Yeah.
is 289, Marathon is 2.1. Really, that increased 3% over last year. That's just that additional 3% increase that we requested from all three counties. The reason why crisis is so large is because you can bill very little for our crisis services. So we don't really have a lot of opportunity to generate revenue. So a lot of that is funded by tax levy.
Okay, is there any data on why people are coming in to the crisis unit, like the different categories that they might be falling into, food, injuries, homelessness, domestic violence, whatever it might be? Do you have any data on that and possibilities on what might be needed in the community to reduce that huge dependency on a crisis unit?
Well, yeah, if you want to.
All right, so we don't have that data right on hand on that, and it's stuff as the new senior leadership team, the three of us have been pretty much in these positions for the last 9 months, and that's stuff that we are looking at. Crisis, I always say crisis is our gateway into all of our programs. So when you look at all the programs that we have, crisis is where everyone begins. So that's why it's so expensive too, because that's where we're filtering everyone through to figure out where they need to go. Crisis is also the main thing that works with law enforcement. So we're working with law enforcement, helping them on a daily basis with different things, lots of calls. But that is, to your point, those numbers are things that we're looking at right now. Actually, starting next week, senior leadership are getting together with some other program directors and that to figure out moving forward the beginning steps of what exactly do we need to track and have that data for so that we can answer questions like that a little bit better, because not all that data has always been tracked. So we're in the process of doing that. And I don't know, Vicki, do you want to kind of jump on some of this?
Yes,
too?
if I may I?
Yeah.
Thank you. So I really want to clarify also the target group that's being served in our crisis response system is those people with mental health or substance use issues who are coming to us to assist with recovery or intervention. So really the list that you said in terms of people being homeless or domestic violence, that's another system. That's not our system. So if somebody comes to us with an issue like that, we would be referring to the appropriate resources in the community. So this number that you're seeing here are for people who are calling or presenting or coming from law enforcement with, again, either a mental health or a substance use crisis for us to respond to. And that's one of our requirements as a county to have a crisis response system.
I have a follow-up question.
Go ahead.
How does Marathon County compare to the other counties as far as mental health crisis usage? People coming in. Are we 10 times over the other counties, 5 times, equal or less?
Do you mean in terms of our partner counties? Or
No, in the other counties.
I would have to see what data I could locate in terms of our number of calls per se, and I don't know how other counties are necessarily tracking their crisis assessments. So I'm not sure how I could track necessarily with other counties outside of our 3. I know we could do some tracking with our 3 counties in terms of which county has the more crisis assessments in person. We have information on the calls that we take per month. So that's the type of data that we have. But again, I don't know what we can do in terms of comparing that with other counties around the state.
Thank you.
So I think these are really great questions, and if we're talking about things that the county participates in that can help prevent crisis, things like the mental health consortium through the schools, making sure that youth and students have access to mental health care and professionals that can help them through things, the nurse-family partnership that's going to help parents raise their children and make sure that the babies are getting the care that they need. Those are really great places to start, and those are things that the county is doing if we're looking at that information.
Yeah.
Lance, did you have something you wanted to say?
I could add it's not data that's directly on point, but frequently utilize the Green Book, and I cite it a lot in the budget, and there are specific pages from the Green Book that the Counties Association puts out that talk about health and human services spending per capita. And as Vicki, Jason, and Gary alluded to, utilizing North Central as our community programs is lead department is one part of that. And I don't have the Green Book up in front of me, but my recollection of looking at that for Marathon County relative to other counties, in terms of overall human services spending, we are below the average and below the median. But I can pull that up in the next couple minutes just to confirm. But I use the Green Book a lot to kind of get some sense as to how Marathon County compares to other counties, particularly as it relates to per capita. A lot of their data is per capita spending, but I can look that up.
Human services in the Green Book seems to be a general term, because would that include social services with medical and food share and, housing assistance and all that? So that wouldn't be, I wouldn't think it would be just related to mental health.
You're right. It's far broader. Yep, absolutely.
Okay, are there any other questions? I'll let Supervisor Covelli go first and then Supervisor Robinson.
Thank you, Madam Chair. Thank you, Jason. A couple of questions on the opportunity slide. I believe there are two slides. The one with the 15% Medicaid rate increase included in the budget. Can you explain a little bit about what the opportunity increase census above budget of 128 pertains to? Explain what the census means and
Yeah, well, the higher the census, the more revenue we can generate. So right now we're limited on where we can be based on the construction that's occurring. So once that ends, we're able to increase that census, which should make us more profitable. But again, the challenge is going to be staffing. But we do think that we can get above that 128 by the end of next year. It's going to take some time to get there. So our average daily census we budgeted was 128. So our opportunity is to
is
generate
that beds or is that people or is that what is?
Oh, the census is beds filled. Sorry.
Yeah, okay.
Yep. We have 160 beds that we could fill. So yeah, it's the number of beds that are actually occupied.
Okay, and I think we talked about that several months ago about changing that from, what was it, 160 to 128 or whatever, when we talked about the revenue from Medicaid, I believe. And the other one, the adult behavioral health hospitals increased census from 7 in 2023 to 9.75 is on the same lines of that bed capacity or whatever, correct?
Yep, that's our average daily census of occupied beds.
Okay, thank you.
Yep. And we have 16 beds in the adult hospital.
If I can add one. So just one additional layer, and I'm sure you guys can cover it if there's more questions. So there's the staffing component, but in my mind, I always like to think about also, particularly on the inpatient unit, there's also, it's the right mix of people too. If that's why Jason brought up safety. If we have an individual on that unit that is really, really challenging and poses a safety risk either for staff or for other people on the unit, it can decrease that census. For those of you that have watched public safety meetings as well, Chad kind of talks about that relative to the youth detention center. So that's another wrinkle. In terms of budgeting, again, to the extent we can get above that census target, to Jason's point, it's a good thing if we can do it in a way that is to our fiscal benefit.
Yep. It's certainly a big opportunity.
Supervisor Robinson?
I'm going to want to go back to the crisis expenses. Were the CART expenses this year built into the crisis services?
Yeah, those fall within the crisis.
So now we're carving them out, or we're...
Nope. So if we go back up to this slide here, you can see crisis 2.1 million. Those CART expenses fall within there. So I guess I kind of misspoke earlier. That $2.1 million for crisis that increase, the 3%, plus the additional levy for the CART program,
So we had 3% plus 240,000.
plus 240,
So,
plus,
but last year you paid for those so when you start looking at what was the increase year over year? So we're actually looking at a 3% plus 240. My concern is that, law enforcement is looking for an expansion of the program, not a shifting of the cost from the crisis allocation plus the CART assessment. And I understand why you're doing this. I guess I'm just concerned about whether this delays the ability to look for additional CART assistance for both the Sheriff's Department and Police Department relative to staffing in evenings and weekends.
I'll give you my 2 cents. I don't know if there's a question embedded in there, but on my end, I don't think it has any impact. This is and Christy and I will talk about this when we get into the county, the specific work we're doing with our county budget. This is an accounting change, really. That's Marathon County, Lincoln and Langley. We're in this partnership together. Marathon County has been the only county with a crisis assessment response team since we started one. We just never actually specifically paid for it. North Central took our previous allocation and said, yeah, we can do that too. Well, the idea of we can do that too with the current resources is just, it's not reasonable. They were very transparent about it. I understand that situation, having been attending those meetings. So the choices from my end are we either allocate the funds to it or we don't. And really, that's a question for this body. And when we had our budget meetings earlier this year, there wasn't any direction to get rid of CART. I think there's not a person in the room probably that is going to say, hey, let's get rid of the crisis assessment response team. Everyone seems to like that program. So we funded it. And the way we did that is through the county budget, we allocated the levy. So I don't know that there's any impact on that levy allocation there's not any impact on our ability to expand the program. We just need to find additional funds to do that. And the example I'll give is that when we created CART in Marathon County, Wausau Police Department allocated the funds for one officer, and Marathon County government allocated the funds for one Marathon County law enforcement officer. It's just that we never allocated any money to North Central Healthcare to take the two employees to do it. So this is kind of going back and doing that. It also is quite honestly equitable with our partners. We're paying for a level of service that they're not getting. We're paying more. So, but to your point, Supervisor Robinson, I mean, staffing, like that slide. If you, the county, want to expand CART, either in terms of hours of service or areas of service, some level of service level increase, we need to find the funding to do that. And whether that's partnering with another law enforcement agency or asking Wausau PD if it's a partnership, an expansion of that partnership, we just need to have those conversations and identify the funding sources.
But at the end of the day, will that result in more crisis services, whether it's CART or others, being available to residents of the Tri-County area?
It would only be available to the Marathon County area if it's a Marathon County
yeah,
position.
CART's
So-
only for right here.
But no, but you're taking Marathon County's allocation, increasing it 3%. CART was currently funded out of the crisis center budget. So you're now putting an additional $240,000 supplemental aid into that, which means that the base is increased by that $240,000, which would mean that some of the crisis, the CART workers go out with law enforcement and do the follow-up. So does this create some capacity internally, because we're paying for those two people separately, to increase crisis services to the balance of the population that is not in that law enforcement CART team area or arena?
No, it would not. This is really just funding, the program that we've been providing for years. We just got to that tipping point where we can't provide it anymore without the funding. So, okay.
Supervisor Covelli.
Thank you, Madam Chair. One question on the health insurance side of things. It says there's a 7% premium increase in 2024. Are you looking to fund that premium increase through the county tax levy?
Well, it's baked in our expenses, so that's baked in our benefit expenses. Now, some of that is reimbursed through our programs, through indirect costs. And employees pay a portion of that as well, so.
So, if you broke that out into what you're asking to increase the tax levy by, how much would that be?
I'd have to look. I don't have that in front of me, sorry. I can get you that number.
If you could, please. Thank you.
Yep.
Are there any other questions? Supervisor Krause?
Yes, I have a question. Do you foresee in the future that there might be another mental health therapist for the jail? I see there's one person now. Do you feel that that's satisfying the need there, or do you think there could be more people?
I'm going to kick that over to Vicki.
Or else I can take it, Vicki.
No, we have ongoing communication with our sheriff's office and our jail administrator in collaboration about what it is that we need to do legally to support the services in the jail, as well as what we can do that is the most beneficial. So the answer to your question is that has not been asked of us to increase that. That has not been part of our conversation thus far. They would not like to have that position diminished or terminated from serving in the jail. They would like to keep that, but there hasn't been a request to necessarily expand either. If there was one, we would entertain having that discussion.
Yes, we have that. And as Lance just said, we have a meeting on November 10th with all the members of the legislature and the governor's office. They'll be at North Central Healthcare to discuss the supplemental payments and what's happened with that and where it's going, and to really advocate for county-run nursing homes. So we have that all set up. I believe that we have 100% attendance so far coming, either the representative, senators, themselves or a representative from their office, so that they'll be there.
Will an invite be extended to members of this committee or the county board?
At this point, because of, we don't want over, I don't know, I guess, Lance, I'll leave that up to you on what you think.
Our plan was not at this point. We'll report back how that meeting goes. I think Supervisor Cavelli had some good suggestions at the last meeting to talk about how the board can get involved. And of course, this is that first step. My sense is the meeting will go well, but that's not going to result in any action without continued action by all of you and the full board. But it's a good first step, and also interfacing with the Wisconsin Counties Association to keep this issue moving forward through their county ambassador program and kind of the issues to move forward with the legislature. For those of you that were at the conference, this was discussed again this year. November 10th. And we will report back. We'll make sure, Kelly, if we can get that on the agenda for the next meeting, just to give an update as to how that meeting went.
I think it'd be for the December meeting at that point.
Yeah, December, because this committee will meet before we meet with them.
All right. Are there any other questions? All right. Seeing none, thank you, guys.
All right, thank you, everyone.
All right, that moves us along to item 5B, discussion of HR, Finance, and Property Committee's 2024 proposed budget and possible recommendations regarding modifications. And I think Lance is going to kick us off.
Sure, I'll be really quick. The couple of major takeaways. We had our first meeting with the standing committee yesterday at Environmental Resources to kind of talk through the budget in keeping with HR Finance and Property Committee Chair Robinson's directive to continue those conversations and make staff available. So I'll start with the big takeaway we used yesterday, and that is, and I said this when I delivered the budget to the full board, this is really a status quo budget. There's not anything, at least from my perspective. I'm sure all the departments will have things they want to highlight. They always do. They're like kids. The department programs are like children. We all think they're the best. Not that department heads are like kids. That came out wrong when I saw you look at me. But, you know, and we do deliver a lot of fantastic programs, and we've made some meaningful changes. But from my perspective, where I sit, there's nothing like, oh my, this is a brand new thing that's $500,000. That's not happening. We've made some important tweaks that I talked about in my budget delivery, but it's largely, certainly from a, at least this is my assessment, you feel free, of course, to disagree, but from a policy board perspective, it's status quo. There's not wholesale changes in terms of our programs and services that we deliver from a policy perspective. That said, from an accounting and budgeting perspective, I'll tell you, on the inside, this thing is, it's a complex moving part. Things, you'll hear us use the word mapped or mapping or map. Oh, it's a lot of conjugation of the word map. Because things have changed. And, you know, a good example is the health department. And I want to own a mistake. I caught a mistake in the budget. I said the health department tax levy request went down 5.3%. It's 5.2. Little math error on my point. It's down 5.2 from last year. But if you actually look in the 2023 budget that all of you adopted in our 5-year levy calculation, and you compare that number to what this number is in tax levy, it's down 9.8%. And the reason why? Mapping. Things got mapped differently when we realigned all of our GL codes, and Christy can talk more about it if you want, but a lot of things have moved. Again, from a policy perspective, a program and service level perspective, those things haven't moved. But a lot of the health department stuff now is in, if you flip to the last page of the budget, that department charts page, they're now in the grant fund, and historically they haven't been. So a lot of things are just accounted differently based on our general ledger, but the programs and services haven't meaningfully changed. So again, my message to you is things might look different, numbers might look different. We tried to be as transparent as we could, but it's a status quo budget largely from a programmatic perspective. So that's my kickoff, and I'm sure now Christy is going to say something somewhat similar, perhaps.
The only items that have really been changed are to map everything to the, as close as possible to the state of Wisconsin chart of accounts as prescribed by the Department of Revenue. We always report that way on the financial report form A. We had to move a lot of things in the old legacy system by spreadsheet. Now they will all be in Workday, pretty much ready to go when the reports are due for 2023. And that's pretty much all I have to say, is that the budget is intact, the budget balances. It's just going to be moved to the appropriate items with the new architecture that we have for the general ledger.
Thank you. So as the committee, we can discuss any aspects of the budget. We have Health and Human, or we have the Health Department, and we have Social Services here today. So if there are questions about their budgets that anybody has, or anything you want them to clarify.
I think they're all ready to go through at a high level, similar to,
Okay.
Madam Chair, what North Central did. And
We
then
can
I'm
do that.
actually pinch hitting for veterans. Jill couldn't be here. She's out of the office
Okay.
for personal reasons.
Okay, so then we'll let the department heads go through their budgets, and when you have questions, you can ask at that time. So, Laura, you want to go first?
Okay. I'm happy to report that the Health Department was able to decrease our levy requests by 5 point, oh, thank you. Thank you very much. Our levy request by 5.2% this year, and this was above and beyond what was expected of us. We did this by not filling a full-time health educator position that had been long vacant, and we also are proposing to increase our fees this year. The Health and Human Services Committee received our full proposal at the last meeting. In addition to that, we were able to further reduce our budget for the Nurse Family Partnership Program, as we no longer have startup costs in 2024. So we saved an additional 8.65% in additional expense since 2023's budget. I just want to mention a little bit about, I know we've said in the past that $1 isn't necessarily $1 for the health department, and that is because we have what's called a match. So we have two matches, and what that means is that it exemplifies why NFP would have a broader, any changes to NFP, Nurse Family Partnership, would have broader implications than just $1. So in the past, we've talked about $1 is not just $1. And the best example of that is our Children with Youth and Special Healthcare Needs program. It's 100% grant funded and provides us with financial support of some administrative costs for the department. But we need to have 75% of the cost of the program invested into maternal and child health programming, such as NFP, to participate. Thus, if NFP would go away or get reduced, it would impact two programs that have matches within the health department. So the majority of our budget is spent in personnel, and due to the nature of our work, the health department's budget is reliant on local, state, and federal sources. The percentage of our budget that is levy is 52.02%. Our fees are at 17.66%, and of course, grants are about 30%. So we've had some questions regarding our Nurse Family Partnership Program because this was our pilot year. So I've asked our new Family Health and Communicable Disease Director, Miranda Eckenbrecht, to come give us a brief update on the first year of the program.
Hi, thanks for having me. So I'll start out just by recapping what is Nurse Family Partnership and then get into a little bit of the results so far. So as you may recall, Nurse Family Partnership is a voluntary home visiting program. It supports low-income mothers and their babies by assisting parents to increase their parenting and life skills. Our registered nurses have specific training to provide that support, advice, and education on a diverse range of topics, including child and maternal health, development, and care. Visits to families begin during early pregnancies and continue until age 2. To date, Nurse Family Partnership is replicated in 40 states throughout the United States, including 8 Wisconsin counties. And in Wisconsin, NFP has served over 2,650 families since 2007. The goals of NFP are to improve pregnancy outcomes by helping women engage in preventative health practices, improve child health and development by helping parents to provide responsible and competent care, and improve the economic self-sufficiency of the family by helping parents develop a vision for their future. NFP is highly structured, ensures compliance with statistical outcomes. There are very specific requirements for our nurses with their training and involvement in order to achieve the expected program outcomes. And again, this is voluntary participation from our families who qualify as low income. There have been more than 40 evaluation studies, including randomized controlled trials and large-scale replication data. And according to the County Health Rankings evidence rating, NFP gets the highest rating, which indicates that there's strong scientific evidence to support it, including longstanding evidence of that approach. NFP also has evidence to support return on investment, and this has been shared previously as well. When we estimate the return on investment, it's $60,428 per family served, which results in a 6.4 to 1 benefit to cost ratio. So with our goal at the Marathon County Health Department to improve health outcomes through prevention strategies and promotion of health, we know that prenatal and postnatal home visiting programs have been proven to reduce rates of smoking, decrease emergency room use, decrease infant mortality, decrease pregnancy-induced hypertension, increase moms' attempts at breastfeeding, decrease a parent's dependence on Medicaid, decrease overall costs on Medicaid, and also decrease childhood language delays. So that's why we support that work and continue to promote that. We began accepting referrals in March. The first few months of the year were spent on that intense training and education for our nurses. And since March, we've enrolled 33 families, which is well on our way to our goal of 50 families by the end of 2023. Additionally, we've received over 200 referrals, so this points to the need that's in our county. Those who weren't enrolled that we've received a referral for have either declined the program, are not eligible, or did not respond to follow-up. Our demographic data that I'm going to share is through mid-September. 19% of our clients are less than 20 years old. 54% are between the ages of 20 and 29 years old, and 27% are age 30 or older. 69% of our clients speak English as a primary language. 55% of our clients have an annual income of less than or equal to $6,000 annually. Only 9% have an annual income of over $30,000. 2 of our clients are dependent on a parent or guardian for care. And 60% of our clients reported during enrollment intake mental health concerns such as depression or anxiety. Of our clients who we've enrolled this year, 73% have received prenatal care during the first trimester. As of September, 4 clients have given birth. And of those births, no infants were considered very low birth rate or required NICU admission. Breastfeeding was initiated with 4 of our mothers. And we'll have more data as we continue to track, as we have more births, and then as we track the child's health and development through the first 2 years of life. We also know the impact to clients based on their responses and feedback to us and our nurses. And I'd like to share some statements from one of our clients with you. As some background, she's currently living with her husband, but her main family support is out of state. The client has shared many positives about the program, is thrilled the services are available for folks, and she states the program is very helpful, that it's comforting to have the nurse come to visit. She appreciates the support and states, it's support I didn't think I needed until now. So that just shares a little bit about the scope of the work that we've done and the outcomes that we've seen to date.
Okay, so that is an overview of our budget proposal for 2024. And we'd be happy to answer any questions about this or the fees as well, the fee increases. And it better do it quick because Kate might go into labor.
Okay, do we have questions for the health department? Go ahead, Supervisor Krause.
Yes, I think in the past that there was some talk about having decreased the cost of the health care premiums and things like that, going to a different company for health coverage. And I was wondering if your budget reflects that, if that's part of that.
I can take the personnel portion of every department's budget. They don't get to touch the personnel costs. That's HR and finance take care of that. So our health insurance this year, as referenced in the budget book, based on our work with our consultant, came in at a 6.5% increase. So personnel-related expenses, salaries, wages, and health insurance, as well as dental, those are all things that, quite honestly, every department should say, hey, those are things that impact our budget. And these are the things we do to try to counteract that, like Laura referred to the fees. Departments don't get to manipulate those things because we know what our current rates are and what 3% is. We don't want departments to manipulate the personnel costs. So there's no ability of any individual department to do that. So certainly we are looking, as always, like Gary and Jason alluded to control healthcare costs, and we're built in the proposed budget from administration that was turned over to HR, Finance, and Property is the cost associated with our continued work with our health insurance consultant. But as of right now, the plan is to, based on our claims experience, to stay with our current provider.
Are there any other questions for the health department? All right. I wasn't at the last meeting, but I want to say thank you to Kate for her incredible fees revamp and explanation. It was a beautiful document, so very nice job. And thank you for sharing the information and the stories from the NFP participants. That's really great to hear how it's helping people, so thank you. All right, Krista, you want to go next?
Thank you. Good afternoon. All right. Is the social services budget up? They'll throw the social services piece up here, but the DSS budget is a vital component to our commitment to our community's well-being. Within this budget, we primarily focus on delivering mandated services that play a pivotal role in assisting our community members who are in need. As stewards of public resources, it's our responsibility to ensure that these services are not only maintained, but they're also enhanced where necessary to continue supporting the most vulnerable among us. This board saw that with our CLTS services and moved it forward with no tax levy in addition. I'm going to share with you some specifics today on how our budget aligns with our mission to provide those essential assistance services to our community and how we're committed to ensuring that those are delivered in a fiscally responsible manner. So social services has 5 primary programs in addition to our administrative staff: income maintenance, child support, child protective services, initial assessment, child protective services ongoing, and CLTS and CCS. I had provided an overview of these programs and their funding streams to the Social Services Board, but I thought that might be beneficial to provide with you a little bit of that information today. So if you'll hang on with me, I'm going to do that for you. Our Youth Justice Team, DCF, is responsible for the fiscal and programmatic oversight of the community-based YJ system. The primary funding for youth justice comes from the DCF Youth Justice allocation and from tax levy. The revenue sources for youth justice come from grants that might be available, as well as collections from child support and Social Security benefits. In our CPS initial assessment team, that's also a state supervised by the Department of Children and Families, or DCF, as you might have heard it, and it's a county administered program. The primary funding for this program comes from the DCF Children and Families allocation, DCF state and county match, as well as tax levy. Our revenue sources for CPS initial assessment come from grants as awarded and available, and then additionally those collections from child support and Social Security benefits, just like youth justice. Our CPS ongoing team, again, is state supervised by DCF, Department of Children and Families, and county administrated. The primary funding is the same from DCF Children and Families, DCF state county match, and tax levy. Our revenue sources are the same through grants and collections from child support and Social Security. And this includes the different programs like CHIPS through visitation, safety services, evaluations, kinship, subsidized guardianship, and foster care. So when we talk about CPS ongoing, while it sounds like one program, there's a lot of pieces within that. And then our children's long-term support, CLTS and CCS, as we've had at-length conversations about, that's a home and community-based waiver providing Medicaid waiver services for youth with disabilities. All those goods and services are provided under the CLTS program, are state-funded directly through DHS. Funding for staff and operational expenses incurred by DSS comes from the case management time billed to the programs or through other CLTS allocations through DHS. And there's no tax levy for this mandated service, as we've discussed. And then our administrative team that provides administrative support to all of those different departments that I've shared with you, and the funding sources are through all of those different funding sources that I've shared. They're spread out. There is some tax levy included, and then revenue sources again are through grants that are available and approved by the board. Income Maintenance provides Badger Care, Food Share, SSI Caretaker Supplement. It is a state-run program with 10 multi-county consortia that deliver those programs to the different counties. Marathon County is the fiscal lead for the 4-county Income Maintenance Central Consortium, that's the name of it, and the primary funding comes from federal revenue, state GPR, and tax levy. And then our child support program is primarily funded through federal revenue, state GPR, federal performance incentives, as well as tax levy, and they also have grants that are available and awarded. So that just gives you a little bit of an oversight. Charts were also provided in your packet showing the year-to-date expenses through the end of June of 2023 for each of those program areas that I've just discussed, and they identify the total percent of the budget expended as of that specific date. So you'll be able to look and see where we're at from the 23. I can share with you, I have the amount of tax levy that's been put into these positions up through 2022. So 49% of tax levy is used for social work admin, 62% for agency overhead, 21% for economic support, 100% for community response, 42% for Child Protective Services initial assessment, 55% for Child Protective Services ongoing, and 62% for youth justice. Again, that's through 2022. So in the 24 budget, you will notice a decrease in the levy request of $474,405, which is a 6.5% decrease from our 2023 request. In large part, this is due to reducing our external contracts for services in our Child Protective Services ongoing team for visitation and safety services contracts. So, for example, those are being reduced from $300,000 to about $31,000 for the safety services contract. We are moving to utilize internal staff to conduct those year analysis, breathalyzer, safety services checks, and we are not looking to add any FTE positions to meet that need. So while we continue to strive additionally then to reduce our out-of-home placements and have reduced our anticipated number of out-of-home placements for youth in 24, the cost of placements, which is set by the state, continues to rise. So despite that, we do see reductions in levy requests based on the reductions in budgeted placements in youth justice and CPS for treatment foster care levels, and in YJ for group home, and then in CPS for residential level youth. It is also really important to note, as Chair Gibbs shared at the last board meeting, that despite our best efforts to reduce numbers of out-of-home placements, if a judge orders a child into a placement, we are required to provide services and to pay for that. So just an important reminder to put out there. You have likely heard, I assume, of the Family First Prevention Services Act. Part of that act, if you haven't heard, is to aim to provide more services within the community and have less reliance on out-of-home care. In part, Youth Justice is able to look at the reduction in out-of-home care placements for 24 for the group home and treatment foster care levels due to the services that we have offered in the community through our intensive supervision support contract and through the Shelter Home Alternatives funding. Our CPS teams are able to offer additional services for families to assist in preventing the removal or increasing reunification timeliness through the TSSF program, which is a grant funded, as well as through the Family Keys program, which this board approved to move forward. In your department narrative, you likely saw the reduction of the number of out-of-home days was our goal for 23, and like I said, we were able to accomplish that for 23 and are looking to further reduce that for 24. The Family Keys initiative, as approved by the board, allowed for 5 families to be reunified and prevented the removal of 19 children as of September. In 23, we did see an increase in placement with kin, demonstrating an increase in placements in more family-like settings, which are less costly and better for youth and families. Additionally, as of September of 23, we had 127 youth in out-of-home care compared to that date in 22 when there was 183 youth in out-of-home care. So 87 of those were in a foster home, 23 were in a home with a licensed relative, 27 were in kinship care, 5 were in a group home, 5 on trial reunification, and 3 in a residential setting. So again, really just highlighting in 23, we were able to reduce those number of placements. We were able to reduce the high level of placements, in part because of the grants that this board allowed to come through to support our families in receiving the services that they need. I had mentioned a bit ago that the Shelter Home Alternatives funding was part of the reason that we were able to reduce our likely placements for 24 in youth justice. And that is the funds that was transferred from the Sheriff's Department for running shelter care to DSSF for alternatives to this type of placement setting, as it is now closed here in our community. After a careful evaluation, DSSS is going to be putting together a program change proposal to transition from the traditional model of shelter care for at-risk youth in our community to the establishment of what we're calling a Youth Opportunity Center. The Youth Opportunity Center will be designed to serve moderate to high-risk youth aged 12 to 17, providing them with a safe and stable nurturing environment, accountability-focused programming, positive behavioral change opportunities, and then personal growth resources. Our proposal is going to seek to address the increasing need for alternative care models that avoid costly out-of-home placements, prioritize family involvements, and offer cost-effective solutions with enhanced oversight. We did complete an RFP process to determine if a contracted provider was able to run the alternative program model that we were considering. In short, like I said, that would allow them to receive structure, programming, and supervision during the day while returning home still daily and engaging their caregivers in that programming as well. But after careful consideration, we have decided not to proceed with the RFP for the new program design. We have determined that the available funds are insufficient to justify outsourcing that project. And so as stewards of our taxpayer dollars, we think that we can better allocate those funds and manage the program internally. It'll maximize our efficiency and our effectiveness with the program, maintain cost control, and ensure alignment with our organization's goals and values. So we are going to look to run that program internally, and I anticipate having a program proposal to the county administrator and to the Social Services Board by November. Other areas that we're looking to accomplish in 24 would be completing a return on investment on the Family Keys program. I shared with you some data today about the amount of children that were able to be reunified and that didn't have to be removed because of this program. And so we will be doing a cost analysis to share with you how much money that program has saved us in out-of-home care dollars. We will be onboarding those new CLTS staff to reduce that wait list that we talked about. We are going to be enhancing the collaboration between Child Support Elevate and our child welfare teams. That really helps to increase the revenues that come in and reduce the money that we need to pay for those out-of-home placement costs. It really just helps overall ensure that those families have a well-rounded experience. And then continuing with our unwinding under our income maintenance. There's been COVID rules and things that have been put in place that go through the end of March, I believe, and so our income maintenance staff has been busy doing all of those things. So all in all, we're looking to reduce our budget for 24. We're looking to reduce our placements and add some really great services or modify some services to be more cost effective and impactful to the families we serve.
Thank you. Are there any questions? Go ahead, Supervisor Krause.
Yes, thank you. I was wondering if you could talk a little bit, say something a little bit more about Central Consortium. I called today around 11, 12, 1 o'clock, and I was on hold for an hour. And I don't know if that's something that, they said that it was a busy time and they were having a lot of calls. So the waits are usually pretty long, but this is the longest I've ever experienced, which was an hour. So I just was wondering if you could mention, what the funding source is for that and what might happen. Thank you.
Sure. Let me pull back up the funding sources for that. An hour wait, I would agree, is quite excessive. They have metrics within the income maintenance for how quickly they need to answer calls and how long they can be on phone calls and all of those sort of things. And you called the Central Consortium? Okay. So it is a program that is funded by federal revenue as well as the state GPR, and then there is some tax levy that goes into those programs. I could follow up for you on your wait today. I think that is hopefully an anomaly. You're welcome.
All right, are there any other questions? All right, seeing none, then we'll move on to Lance for veterans.
All right. I will not give nearly, who's got the scrolling thing? Do I have it? Oh, I walked way too far. So as I said, Jill couldn't be here today. Just talking through her department to give you a little sense of what the Veteran Service Office does. Again, if you look in the budget book, it gives a good overview. They really are a very good point of contact for any veteran in Marathon County when they're seeking assistance and applying for benefits. Benefits are largely handled at the federal level, but that application process can be coordinated and assisted at the local level. So Jill and her team, it's 2.8 FTE within her department. So small but mighty is the phrase I would use for them. Their budget is, when you talk about status quo, this is as status quo as it gets. Their increase is about $7,000, and that is entirely due to wages. They have 3 individual wages and health insurance. That's the amount they're up. They are very lean. But when I talk about the value of what the Veteran Service Office does, and we have some of this reporting information within the budget book itself, but again, they are the point individuals to help people apply for benefits. So if you think about it from a community and even an economic development perspective, when we have an individual that applies for and receives benefits that they are rightly entitled to, that can mean for that individual, depending on the length of the eligibility claim, quite a bit of past due funding that comes in. And that certainly for that individual has a significant impact, but also if you think about it as I referenced from the economic development impact, there's a lot of a lot of dollars that are spent locally in our community. And I'm just pulling up I get monthly reports from Jill in terms of how many new monetary awards come in year to date. And when I look at the most recent report I got from Jill for, I believe this was September, year to date, it was $1.2 million of new claims. That's not ongoing claims that individuals continue to receive those monthly benefits from the VA. These are new claims. You've probably seen a significant amount of those claims referenced were new programs that were initiated at the federal level. The burn pit legislation to allow for those benefits to the eligibility determination to be expanded. So Jill and her team work with individuals on those programs, but also very importantly, when we do have a veteran that passes away, they work to coordinate burial benefits for the family with local funeral homes and local cemeteries. So their budget is very straightforward. You kind of got the two extremes of departments in Marathon County. We have social services on one end with 125 plus employees, and then you have a department of 2.8 with veterans. But happy to try to answer any questions that you might have. You will see one change. We historically have always had funding for kind of administrative assistant work when the Veterans Office staff have to get recertified on a regular basis to be able to have access to the VA database and submit claims or work with individuals to submit claims. And we had historically, that office had contracted with a employment agency to just have someone staff that office when they had to all be out of the office for that training. We coordinated for internal service coverage. I think this is another thing, and you'll see it written in my budget message. It's been my experience when we have the more departments we have co-located together, those opportunities for office sharing and just assistance are more readily presented. So we're going to do that internally. It saves a small amount of money, offsets a little bit of that increase that you would have seen from increased personnel costs, but I do think it speaks to kind of the mindset of Jill and her team of trying to be, as Krista alluded to, good stewards of tax dollars. But that's all I have, Madam Chair. If you do have questions, I can do my best to answer them relative to the Veterans Office, or certainly I can be in touch with Jill to get that further information for you.
Thank you, Lance. Are there any questions for Lance or anything that you want him to inquire with Jill about? Okay. So seeing none, I believe that is all the committees or the departments that are here today to talk with us. So the rest of this agenda item is possible recommendations regarding modifications. So does anyone have any discussion they want to lead about possible modifications to any of these departments' budgets? If no one from the committee has anything, I'll open the floor to Supervisor Baker. All right, go ahead, Supervisor Baker.
Thank you, Chair Van Cray. Can you put up the graph that I had shown?
Is it the one from the email?
Yes. I'd send it to Kelly.
Oh, we did send it to Kelly? Okay.
Actually, I sent it to Chris, and he sent it to Kelly.
It's not in the packet, no. No, it would have come via email. I can send it again to Kelly if you need it.
Is it from a previous packet?
No,
I
it
don't
was never
believe
in a
so.
packet, but I sent it to Chris, like, at the beginning of the meeting.
Oh, at the beginning of the meeting.
Yeah, just so he had it.
So it would have just been forwarded to you today, Kelly.
Sorry for the delay. I emailed it to Chris, and he forwarded it to you.
Does anybody have a good joke?
I'll go ahead and start. Well, there.
Okay, I
Okay.
would like to hear your joke.
What do vampires use to pay their bills? Cryptocurrency.
Thank you. Is that a finance joke? And Halloween, perfect.
Well, I don't have a joke, but I do have an answer to Supervisor Krause of why you had such a long wait today. As I said, I was hoping it was an anomaly, and it is. There were 3 different phone systems that were down, and as I said, we're a 4-county consortia. So our partners in the other locations were unable to answer calls today due to a phone system being down, so all Marathon County staff were reassigned to take those calls, and we're taking them as quickly as possible. But on average, we do have a 10-minute answer, so wanted to be able to share that with you and followed up quickly as to why.
Okay, I'm going to go ahead and start.
Okay.
So I was reviewing the audited financial statements from last year and also looking at the CIP rollover. The finance director had sent me the formula, and the finance committee as well, the formula for the rollover. And while I was looking at that, I noticed that, there's a graph, that the social improvement fund was relatively flat for 6 or 7 years, 5 or 6 years, and then increased dramatically over the last 3 to 5 years, 4 years, about $3 million a year. And I'm, not trying to be critical, because that's, probably a good thing. It's good stewardship, financial stewardship, that, we were able to set aside money into that fund. But what I'm requesting is that the committee consider making a recommendation to HR Finance to reduce the 2024 Social Improvement Fund tax levy by $1.5 million from $6,935,723 to $5,436,723, and to reduce the overall tax levy from 57,954,347 to 56,454,347. So this would reduce the use of debt levy from 2,553,100 to 1,053,100. And I want to note that this request should have no impact. It doesn't reduce the 2024 budget expenditures for the Social Service Department anyway, and it should have no impact on our ability to provide needed services to the residents of Marathon County. The purpose would be to lower the tax levy increase, which is in the budget message at 5.7%. It would go down to just under 3%, like 2.9 probably. The goal would be ultimately to try to get that, my goal would be to try to get that tax levy increase to net new construction. And there would be some other aspects to that also. So I don't believe that it would actually lower the social improvement fund. I'm sure we can get feedback from the administrator and social service director, but it has been growing up about $3 million a year. The tax levy request was decreased by 400,000. So if we decrease it by another $1.5 million, that looks to me like that line would go from a $3 million a year increase to a $1 million a year increase. I don't think it actually would be going down. I mean, it would depend on, you know, if we have to put more children in, you know, provide more care. So there's variables, but there is $14 million there that's a buffer. So I don't see that we would be putting the county in jeopardy or the services that we're providing to the residents of Marathon County in jeopardy. It would just basically allow us to not put as much money away as we have been and not increase taxes on the residents as much as the budget message. So I'm happy to answer questions if that's okay, if anyone has them, or, you know, I'm sure that there will probably be some feedback from the administrator. And so thank you.
Thank you, Supervisor Baker. So I think Supervisor Robinson?
I have no feedback. I'll answer questions, but I'd hazard a guess as to what, if it's going to grow or not. For the reasons you said, exactly. Like, when you look back, some of that's in 2020 when I put a hold on filling positions, and Vicky's still in the room, and she remembers that very well. So it did grow a lot in that period. We also had a lot of funds coming in from Routes to Recovery and, of course, any other governmental grant funds that social services got from the state to decrease operating expenses and, of course, placements. But I don't have any feedback on, whether or not the county board wants to spend out of reserves, to decrease. I mean, you're not decreasing, to your point, you're not decreasing the overall budget of social services. It's just a question as to how to utilize your reserves relative to tax levy management. So I don't have any feedback on that.
My concerns.
Good thing we're getting those new microphones.
My concern is, I understand what you're trying to do. I'm not sure that this language does it. I think what you're trying to do is take the fund balance and insert it and not into the levy. My concern is, as in the rough form that it's before us, is that you would reduce the budget for those programs this year. And I think your intent is to take some of the existing social improvement fund balance and increase the revenue by that amount, and not necessarily reduce the expenditures in the social improvement fund, which is social services. One of the concerns that I have is that this information is still new. I think we're starting at the HR Finance Committee level looking at it. Our policy would be is that those reserves or any money left over in whatever budget, if it's not restricted, would go into the capital improvement fund. And that would then offset the cost of our capital improvement. I'd like to have that discussion at the Finance Committee of whether or not we should capture some of those social improvement fund balance dollars for our actual capital improvement program going forward.
Can I ask a question? Why wasn't any of that captured previously for the capital improvement?
We did a presentation at the last county board meeting where we discussed that. And at the end of that packet, there's also a item which shows why we had accumulated the funds, probably could have transferred them. Using the old system is quite cumbersome. Actually, the spreadsheet you saw today from social services, that has been inherited even before my time, Colleen's time, maybe Vicky's time. It was there. That's how we calculated how programs worked. That money is there and available, and we did do a analysis of what we believe would be the best estimate of what the county portion of each of those services are based on that additional information. So that's why they were there. Most of them, again, were in unfilled positions, contractual services for items in youth aid, and for budgeting at a foster care level higher than what the actuals were. So that's why they're there. I'm not sure what the proposal is, but those would, again, roll into CIP. That is what the current county's policy is. But if there's alternatives that would be addressed, that would go to Finance Committee. The only other item and caveat is that fund balance, tax levy is not tax levy. Not all tax levy is the same. And if you withdraw a $1.5 million tax levy from an operational portion of the levy, it then decreases your ability to levy to the operational levy limits in future years. So there is probably ways to do that, and there's probably some ways to explore those types of items. Because, again, debt levy is a different type of levy than operating levy, and social services is under operating, and debt is its own item under the debt levy limits.
Okay. Go ahead, Supervisor Baker.
Thank you. So to Supervisor Robinson's point, I would, there may be different ways to do it, but the proposal that I have is that the expenses are not changing. The budget expenses are not changing at all. The budgeted revenues are not changing at all. The tax levy that's being associated to being allocated to social service, it would be changing. So that would be either we would be putting $1.5 million less into the fund balance, or we, depending on how the expenses come, we might be using up $1.5 million. So we might have, instead of having 17 million at the end of the year, we might have 15 million, or we might have 12 million. Either way, we have a substantial amount more than 5 million, which is what we've had historical. I have the same question as Chair Van Cray. We want to put this in the CIP budget. Well, we've been doing this for 4 years, and no one mentioned that until I pointed it out, just like you had said. It hasn't been going to the CIP budget. Also, I have a graph that shows, I'm not going to even try to get it up there, but the supervisors all have it, that basically shows the difference between historically when it's been balanced and when it has been going up. To a large part was that the social services quit contributing to CIP. I don't know why that was, or how that impacts, but that, if you look at that graph, I actually put expenses plus CIP contributions, and they were pretty close to the amount until the last 3 or 4 years that diverged. So I'm not sure how that impacts. And in terms of finance director comments, the intention is that the amount of money that we're reducing, the $1.5 million that the proposal would be reducing from social services tax levy, would be replaced by $1.5 million of debt payment, which would be made under the tax levy, not above the debt So the debt levy amount would be going down. Like I said, it would go down from 2.553,100 to 1,053,100, which is, I believe, pretty close to what the debt levy limit was last year. Last year, we also did not cover all of our debt under the debt levy limit. We covered a lot of it under the normal levy, which is subject to the levy limits, and we'd be doing that same thing. This would not be impacting our ability to, going forward, to maximize our levy limit. So, thank you.
Krista, do you have any comments about concerns if that fund decreases by the 1.5?
I mean, as you can see, that fund is quite healthy, particularly over the last few years, and we've spent a lot of time evaluating why that is and provided a presentation to the full board last week about that. I would not have any significant concerns to taking a portion of that money from tax levy from this fund. I think it's important that we have money in this fund. We had shared the amount that would be available for the board and the amount that was restricted. We need to make sure that we have funds in there in the event that we have placements that we don't account for, particularly high cost placements. Lincoln Hills, a couple kids who make some really bad decisions can really make a huge difference in our budget. We don't want to have to come back to a board and ask for an amended budget. So I would just ask that there's some money left in there as a catch for us in the event that we need it. There is monies in here that aren't accessible, that are restricted, but for the money that is available, I don't have any concerns.
Thank you.
I don't have the documentation to know exactly what the proposal was, but if the proposal is to reduce the debt levy portion of the tax levy by using fund balance from social improvement, I think there's a path to do that, which would maintain your operating levy at the levels that it is, reduce the overall tax levy, and put that attributable to the debt service portion of it. If that's what the intention is, I think there's a way that we could make a path for your proposal. And I don't want to speak out of turn because I think that's what you're looking for.
That is the intention.
Yep.
I thought I had copied you on the original proposal, but I'll send it to you again.
But I think there's a path to that, and I don't know if it would be particularly the levy portion of the social services, because that would maintain the operating levy, but yet would be the 1.5 from the social improvement fund balance that would offset the tax levy on the debt levy side, and then the debt levy would be the portion that would reduce the overall tax levy.
I'm not going to claim that I know the proper accounting entries. Yeah, thank you.
Okay, so a legal question, Mike, or a procedural question. Do we have to have a motion to ask HR Finance to look at this recommendation, since it's not an amendment at this point? The chair is nodding that they will do it. Can you comment? Yeah, sure.
I believe, I don't want to impugn anybody, but I believe that the request would carry more weight with the Finance Department if the Social Services, if this Health and Human Services Committee, the request came from them rather than from me.
Mm-hmm.
Yeah, and that's why I'm asking.
The request is coming from this body. I just need to know if we have to have a motion for it or if it's just one of those like consensus things.
Well, if this body doesn't make a motion, it would be up to the HR Finance Committee whether to consider it. If this body made a motion, it would be, they would have to consider it. So I guess it's up to the committee how you want to proceed. You could do it either way.
Okay, so does anybody want to make a motion for the HR Finance Committee to consider the recommendations regarding the Social Improvement Fund? Supervisor Arstead, is there a second? Supervisor Covelli? Go ahead, Christy.
And I'm just one supervisor. Would you want that to be the tax levy removal from the Social Improvement Fund, or from 1.5 million from the Social Improvement Fund balance to be transferred to the 2024 budget to offset debt service, and then that would then be applied to the tax levy for debt service and then reduce the overall tax levy for the county.
I will trust you to interpret the intent of the request.
All right, so does the committee have any further discussion on the motion? All right, seeing none, all those in favor say aye. Aye.
Aye.
Opposed? All right, none opposed, the motion carries. Are there any other discussions regarding departmental budgets? All right, seeing none, I think that brings us to the end of the meeting. We have no operational functions required by statute, ordinance, resolution, or policy, no educational presentations and committee discussions. So item 8, next meeting date and time, announcements and future agenda items. 8A, committee members are asked to bring ideas for future discussion. 8B, next meeting is Wednesday, November 1st, 2023 at 3 p.m. Do we have a motion to adjourn? Motion by Covelli, is there a second? By Krause, all those in favor say aye. Aye. Opposed? None opposed. We are adjourned. Thank you.